morning. Thank you so much for stepping into my queendom for another exciting episode of Queening with the Empress with me, your host, Patience Pet Phiri. And a wonderful welcome to my live audience that is here because this is what we're doing now. We've moved up with the times. Today, we want to talk about the importance of women's health. I am a woman and my health is very important to me. And it worries me that it is not important to maybe lawmakers, decision makers, because access to good health is not somehow top on the list. We talk a lot about it, but on the ground, the practice seems to be different. I know that according to the Constitution, it is my right to have access to health. And also, according to Sustainable Development Goal number 3, access to good health and well-being is also a must. So in a country like mine, I don't know about where you are and what the situation is there, but in a country like mine, access to health seems to be more connected to the amount of money you have in your wallet or your purse or wherever you hide your money, or in your socks or wherever it is. And then it's even worse for women to access good health care. We've had a lot of cases of women dying when they're giving birth and things like that, things that shouldn't be killing us, or breast cancer, or cervical cancer, all those things. I don't think they should be killing us in 2021, but these things are happening. So to talk about this and so much more with our live audience, I have the amazing Anna Miti, who is a journalist. Anna Miti is a journalist, and she's one of the leading health journalists in Zimbabwe, and a feel-good person. They're just like my personal person. Hey, Anna.
Hi, Queen. Thanks for the introduction. Yes, I'm glad to be here.
Oh, thank you so much. You good?
I'm good.
So today I've brought you on for a conversation on something that I know is close to your heart, because even when you go on radio, everywhere you go, you are even a trainer, like you've taught. I know I've sat in a few classes or lessons, I don't know what the trainings, where you've taught us a lot about health. So today I want us to talk about the importance of women's health, and I know you're the best person to do this. What are we talking about exactly when we talk about women's health, Anna?
Right. So I need to add that, yes, I like what you're talking about, the media training. I work with the Humanitarian Information Facilitation Center, which basically, looks at availing information to people. And one of the things that we do is train journalists, because health is a little bit, complicated. So we want everybody to be on the same page. I also work with the IAS, the International AIDS Society. I'm a fellow. I also work with an organization called AVAC. We do a couple of things. Now, women's health, I'll take it from the first perspective, which is the definition of health from the World Health Organization, which is that it's general well-being, not just merely an absence of disease. Now, when we then talk about women's health, I want to go the extra mile and say it's more than just, because when we talk about women's health, usually it's reproductive health, right? Which is really huge. But we also want to look at health from a gender perspective, where you say, for example, in mental health, depression affects both men and women. But depression, when it comes to diagnosis, to care and treatment, it definitely has to be different, the way that it is done for men and the way that it is done for women. How do you diagnose depression in women? How do you look at postnatal depression as a extra branch of mental illness or a different branch of mental illness? All those things. So it's health in general, as in, not just the absence of disease, but wellness, but also from a gender perspective, where then you look at how, women just being women in a patriarchal society and how their health and well-being is being affected.
Okay, what is the situation in our country when we talk about access to health, especially for women?
Right, so very difficult because it's one of those things that I'm really passionate about, like you said. What you mentioned in the beginning, that money is definitely a big part of it. How you access health, where you access health, and what problems do you actually seek out? When you're looking at health, How do you balance taking money for school fees, taking money for food, and going to then access health? So money is a huge part of it. It also affects even where people have access to free medication like arts, for people who are living with HIV. But there's that extra layer of out-of-pocket expenses such as transport. It affects you. You won't be able to go where, even if you are offered free, it's just the transport to go there. You look at issues like food and nutrition. How do you live in how are you able to afford food and nutrition, which then affects your health? So the access is definitely very much linked to money, but there's also another layer of patriarchy when it comes to women now. For an example, we know that women who are in a patriarchal society usually leave decisions to men. To say, for example, you tell the husband that I feel unwell and I want to go to the clinic, and the husband will say, well, not now. Or maybe they've got religious background where they would say, no, women are not allowed to access, medical care and all those things. And then another aspect of it also of the religion being being discouraged from going to access health, and that also affects women.
Could that be one of the reasons why I know from personal experience that women hardly ever make it to the health center until whatever it was is something bigger, until the pain is unbearable? In cases of cancer, we don't go for screenings. We wait until we have to go there, something is deathly wrong, and we get there, you're told to stage 4 or something. Could that be one of the reasons?
Yes, definitely one of the reasons. So generally, we know that women have better health-seeking behavior than men. We've seen this with HIV because we know more women are know their status than men. We know that even in COVID-19, there's been more men who've been dying of COVID than women, all those things. However, now those delays, she may want to seek help, but then she doesn't have that access. So that's definitely one of those big things, the access. And then another thing that I think is women, we sometimes do, we have to take responsibility for that. The strong woman syndrome, where we think, well, I can go through it. I've got this pain, but I think I'm okay. It's okay. I'll go through this. It's fine. Maybe it's part of just, growing up, or maybe it's just part of being a woman. There are women who've given birth 10 years ago and they still have some symptoms they still attribute to that, 10 years ago, I gave birth and I had a pain in my abdomen. So it's probably part of it, but it's not, and we have this strong woman syndrome, and by the time we go there, it's late. Like, for example, the cervical cancer that you mentioned for testing, someone is bleeding, in between periods, and they think, it might be something else. It might be my tablets, it might be contraceptives, or I don't know, or maybe that's just the way it's supposed to be. When I gave birth, I had some bit of pain, so maybe this is it. And by that time you realize that this pain is not normal, it's a bit late.
That's right. Before I pose a question to the audience, I would love to ask, in recent times, Anna, there's been a lot of reference to similarities between how we are dealing with COVID-19 now and HIV. What's your take on that? People are like, no, it's the same, we didn't get enough information, but then going forward, we'll just live with it and we'll figure it out and things like that. There's been so much comparison between COVID-19 and HIV.
Yeah, so for that one, very interesting, because there are two things. The first one is, yes, there's a lot of similarities between how we've dealt with HIV and how we've dealt with COVID-19. For our starters, the stigma and discrimination. We have had this thing of, at first people are they're in denial. No, COVID is not that bad. Like the way we said, HIV is not that bad. But once you're told that this person is HIV positive, or this one tested positive for COVID-19, we run away. Like we start discriminating against this person. And then the other thing is the experiments. We've had African potato for HIV treatment for years. People talking about the African potato. People talked about moringa. Now we're hearing about Zumani. We're hearing even about snuff. The water that people take. So there's a lot of similarities. But then the other thing, though, is the false equivalence. I know people like to say, well, why are we having this vaccine when HIV has been there for longer and there's nothing about HIV? There's a lot of strides that have been made about when it comes to HIV, to the HIV response from treatment. We know art works. So yeah, that's good, right? And then we know that there's prevention that is there. With COVID-19, you can't really talk about prevention. The masks are great, sanitizing is great, but imagine a disease that you get just by sitting next to someone in a bus or a combi. Unlike HIV, you're not going to get it by sitting next to someone. So it is an emergency. COVID-19 is a global emergency, and we need to take it seriously, and not do it like the way we did with HIV in the beginning, where we were in denial. Then we started all this funny stuff that we do.
Okay, and just quickly, when people come up with these remedies that they feel work, what's your one word for them? Like, please say something, because you have so much information. What's your one word? I was like, no, I'm going to take this, because I know people have been going around shame. They've been trying. You can't stop them.
So I have to be cautious about this, because people take things seriously, and I do understand that. I have to acknowledge that yes, there are remedies that may work for some people, but we don't know this. We don't know. I think the one word there is that we don't know. Somebody took Zumbani, right, and they got well, but we know that sometimes COVID-19, some people don't even have symptoms, so we don't know. We don't know whether azithromycin worked for them or not. And right now we're talking about ivermectin, and even the company that makes ivermectin said, no, we don't know that it cures COVID-19. So we simply don't know. It's better to go with the things that you know and take, the advice that you really, get from medical professionals, and not just because Anna said it. Because I could simply tell you I got cured because I had the blue scarf on, and
Yeah.
I was cured of COVID-19, and maybe it worked for me, but it doesn't work for you. Yeah.
Okay. And then I would love to find out from the audience and also from you, Anna, do you feel there's enough information dissemination when it comes to women's health? What's available, where it's available, when it's available, why it's important, and things like that? Have you had any experiences? I will share that every year I try to at least have 4 HIV tests. And it's always interesting that people, when I do test and I do share with whoever I share with friends, and people are quick to assume that I must have had probably unprotected sex, which is why I'm testing, or I am living a life that is questionable, therefore I am testing. And it worries me that so many years later, we still want to have a reason to test. And now I'm trying to get a cervical cancer screening. I'm struggling to get a place that can do it. And I'm thinking, I have some resources. And if I'm already struggling like this, one person said I need to drive up to Eskodini hospital so that I can get it there. And I'm thinking, but I'm in Bulawayo. Why am I driving out to Eskodini? So if I have this information and I have the resources and I am struggling this much, what happens to everybody else? So that's my experience, that like, should these things not just be there for every woman within their area?
It is when we think about it, because so for me, health in Zimbabwe and the health sector in general, we've had some wins, which we really should be proud of, and that's for starters, primary health care. Now I remember 10 years ago, 15 years ago, our local council clinics, women used to go there, like when you book your pregnancy, you go there and you get health information every time you go for the antenatal visits. There's a nurse there who's got a class, and they hold these classes and they teach you all those things, which was great. We have village health workers, right? They go around telling people about, like, for example, if you're in a malaria area, they tell you about malaria. If there's a problem of maternal health, they tell you about antenatal visits and why they're important and all those things. So those systems worked, and there was a reason why we had them, and we had gains and wins because of that. But unfortunately, we've neglected them now. So you find that even if you go to the local council clinic, because they are on industrial action, incapacitated as it were, you're not going to get it, right? You don't even have the money to go there sometimes, because back in the day, maybe it was easier, the economy was better. Now you can't, right? And then we also had, programs on radio that were especially catered for women. Like you'd find, for example, the old Radio 4, the educational health programs, it was just meant for education. We don't have that anymore. So in terms of information, listen, there is a lot that is missing, and women are suffering because of the lack of information. I was doing a research with an organization where we were looking at fistula, obstetric fistula, which is something that happens, to women when they delayed or prolonged, labor and all those things. And there were some women who have had fistula for years. They thought it was normal to leak urine after birth. They just did not know. There was no information. And even to say, okay, what is fistula in Kalanga? What is fistula in Debele? What is fistula in Shona? Those things are important. And how do you make them understand? How do you give that knowledge to such information to people like that, to people in I don't want to call them marginalized areas, because they say we are the ones who are marginalized from them, we don't want to discriminate on that basis. But just to say, people who ordinarily want to have that information at their fingertips, like maybe other women who've got resources.
Okay, I would love to find out from the audience, what do you feel that there is enough information when it comes to women's health? What have been your experiences? Please feel free to share, raise your hand up. Let's have this conversation. Let's change this narrative that women should not speak about what is hurting them, what is giving them pain. Let's talk, let's share, because like I'm saying, I am worried that I'm way into February. I'm going into the third month of the year, and I've not been able to get my cervical cancer screening, which is very important because I'm almost 40. So I know that it's something that I need to do annually and blah, 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 blah. But if I can't get it, that means that I try once or twice and then I will just stop. And by the time maybe I finally do it, something could be wrong. I don't want to get there. I'm trying to be proactive. And I feel that maybe I'm not getting the support from relevant authorities that I need. So please remember to raise your hand and we have the conversation. And then, what are the leading causes of death for women in Zimbabwe, Anna?
So we're looking at cervical cancer, which is really big, and then maternal health, which is also...
You're scaring me, Anna.
Exactly. And you know what's worse, Pat? What's worse for me when it comes to cervical cancer is that A, it's preventable. B, it's treatable. Like right now, we've got the HPV vaccine to prevent cancer, but kids are not in school. So those who are due for their vaccines, I remember I asked the Minister of Health on Twitter and I didn't get an answer. Where are those kids getting their HPV vaccine? It's preventable, it's treatable. We need to, that's the scariest part about it. And of course, maternal mortality, which for me, again, most of those maternal deaths are actually preventable. That's bad.
When it comes to maternal, like for me, neonatal and maternal deaths, they worry me because everywhere else in the world, numbers are dropping. And I think we are starting to increase, and that should worry us.
We've had gains, like I was saying, we've had gains because, we managed to drop from about 960 to around 614 per 100,000 live births, which is great. But that was before we had COVID-19, and that was before we reintroduced maternal user fees, right? Mm-hmm. And that for me means that all these the delays that then come in will that affect us, that the delays that contribute to maternal mortality, they start affecting us as well. Like when you're talking about neonates, the health of the mother is also very important, and we're realizing that we've got half the population in Zimbabwe which is food insecure. You're looking at women who've got microvitamin deficiency, all those things, the micronutrient deficiencies due to lack of food and poor nutrition. And yes, the child will also be affected if they fail to breastfeed. Some kids are not even getting their vaccinations on time. We know BCG is supposed to be given within days after birth, but a month later, I see people asking on Twitter, where can I get BCG in Harare? That's bad. Yeah.
That is worrying, and the fact that I'm talking about cervical cancer screening and you put it top of the list. If I needed fire in my bottom, I just got it. If I needed fire, I think I might end up making the trip out to Escondini to get my screening. Wow. Okay. What tests and screenings, in your opinion, women must have every certain period of time. Like I'm saying that I try and do my HIV, and I am also doing my breast one. I do the breast one. It's after my period. I need to, that one I do try and do a self exam. But I also like when I do the cervical cancer screening, I like to have the sister touch me up and fill me out that everything is still in check. And which other one do I do? I do the sugar. I do the hypertension one. What else do I do? I think in my world maybe. What should women look out for?
Important. And I see someone's talking about the issues of HIV and the risk of cervical cancer. So we know that ordinarily women, yes, have a high risk of cervical cancer in a country such as ours, but women who are living with HIV are 4 to 5 times more likely to get cervical cancer than women who are living without HIV. So that's quite something. So with cervical cancer, there are two things. There's the VIAC and then there's the pap smear. The pap smear, I know I have to be very personal.
So I'm Team VIAC.
Yeah, Team VIAC. VIAC is easier. VIAC is more accessible. It's just unfortunate, like you're saying now, that with COVID-19 and the challenges in the health sector, it's no longer as accessible as it used to be. So those are top two for me. VIAC and pap smear. The older you are, the more the more regularly you should have it, right? And I like the fact that you're talking about the breast there, because breast cancer is also quite important. Your numbers, cholesterol, hypertension, the issues of sugar as well, very, very important. People need to do that. And then there's an issue that we always forget. People living with morbidities like those who've got hypertension, you need to get regular checks. Besides just checking your BP, there are other checks that you should have. Unfortunately, some of them cost money. Like, for example, people who are living with HIV, you need to make sure that your CD4 count, CD4 count, yes, but viral load testing is done, liver function, kidney function, all those things, they're very important. It's just that we don't get enough, resources to do those, and our health system is really, there's just a lot going on. We need those tests. Yeah. And then depending on where you are and where you live, there are other things that may affect you in terms of risk factors. Like, for example, people who are in societies where there's TB screening is very, very important. You can also get TB screening. And yes, women sometimes tend to not have the time to do that, but it's better to do that, to have your screenings in check and all that's done.
Okay, I think let me hear from the audience. Rachel, are you there? Okay, while we wait for them, I think let's talk about what's new, what's happening in the world of health. Let's talk about my thing, about that ring. I want to hear so much about that ring.
Okay, so I'm very passionate about HIV, and most people who know me know is that one who always talks about HIV. So why for me HIV and women in particular is this: we know that women are more likely to get HIV infection than men. This is due to a number of reasons, including biomedical. The fact that women have a larger surface area to receive, in heterosexual sex, especially in a context such as ours, where that's more or less what you get almost every other time. So you find that women are more likely to get HIV. Then there's also that aspect of them being able to negotiate for safer sex. So for HIV, we know condoms work, both male and female, but they need negotiation. And a lot of times, because women are not at an advantage when it comes to negotiating for condoms, you find that it's the men that takes the lead. And most men, for some reason, they don't want to use condoms, right? So it exposes the women. And then because men have multiple sexual partners, so even if she's married, she knows that he's got 3 other side women, side chicks, whichever way you call them, and she can't do anything about it. But it's because of the patriarchal nature of our society, where you're a married woman, you're not going to demand condom from a man, even though you know for a fact that last week he gave me an STI. You're not going to demand a condom from him. And sometimes, even if you do say, okay, I think you gave me an STI, it might actually turn on you, and you become a statistic of gender-based violence, where he says, I think it's you. You are the one who gave me. What makes you think I'm the one who did this STI and all that? So important is that we need a female-controlled device or female-controlled options for HIV prevention. STIs, yes, we need them. We need to be able to prevent STIs, but we know that they are treatable, right? It's easier to do that. Unlike HIV, where yes, art is very important, we have it, but it also brings with its own, challenges and all that. And then we know that when you then prevent HIV in a woman, you're also preventing HIV in an unborn child and subsequent children that she might have. So it's important to prevent HIV in women. It's important for them to have a device that they can use to prevent HIV that they can control, which then where then the Pivirin ring comes in. The Pivirin ring, it's a silicone ring that's just like the size, and it contains a drug called the Pivirin. It's inserted inside the woman's vagina. It stays there for a month, and it slowly releases medication that prevents HIV. So the studies were done. There's been studies for about 10 years or so now. There's been follow-on studies. There's been even here in Zimbabwe, in Zambia, in Zimbabwe, Malawi, Uganda, and other countries, South Africa. We've had those studies, and it was shown that this ring is actually quite effective in preventing HIV in women. So last year, the European Medicines Authority, they approved it. They said this is something that is good, let's pursue it. And just recently, the World Health Organization recommended it as part of the basket of options that are availed to women. Like if you go for HIV test patients, they're supposed to tell you that, oh, you're negative. This means that you've got option A, which is PrEP. You can then use the ring, which is another option. They give you these options, and ring is part of it. Especially for those women who would say, my husband would beat me. Because once you insert it, he doesn't have to know. He doesn't have to feel it. It's just something that you can use. It's within your control. And you know that for that month, you are covered. But there are follow-on tests as well, maybe to include that ring to make sure that it lasts for 3 months. Then follow-on studies on if we could have a ring that does both a prevention of HIV and also contraceptives. So I'm very excited about it because this announcement by the World Health Organization was like 2-3 weeks ago, a couple of weeks ago. Yeah, so great news in terms of HIV.
When does it hit our shows? I want to sign up. Where do I sign up? Where do I sign up?
Listen, this is why I'm excited to be here, because I know you're one of the people who can hold the placard and say, ring now.
I'm that one. I'm your brand ambassador. And please don't forget me. My name is there at the top. I'm there.
Exactly. So we need advocacy. We know that from World Health Organization recommendations up to the time that it becomes part of our health, system or health response in Zimbabwe, it might take time. But if we have enough advocacy, if enough people know about it, then I hope that it will be much faster. I mean, we've done it for COVID-19. We haven't had to have vaccine go through all these other funny regulations because we know it's an emergency, and HIV is an emergency. So yeah.
Thank you so much for watching. This is where we stop for today. Please be sure to watch the final conversation next week on the importance of women's health. Remember to stay watching Queening with the Empress.